Thanks. Thank you. Representative Josh Miller, you recognize.
Thank you, Mr. Chair. Kind of to start off with, to reiterate what Senator Teague said, I've spoken with you, Mr. Williams, on several occasions, and you and the folks in your office have been extremely gracious and kind and super helpful, and I really appreciate that from my end. But I've got a couple of questions, and number one is I'm continuing to run into folks in my district and around the state who should be shoe-ins for either our kids or Medicaid or whatever these programs are, and they're literally having to wait months. And these are folks that are, these are the type of people that these programs were set up intending to help. And they're, this is like when I called you, Ms. Williams, and I run into several times, yet I turn around and read how we are continuing to sign up enrollees on the private option at a near record pace. But we've got folks who are, really struggling that are honestly, we could not find a more classic example of what state benefit programs are set up to help. And these folks are having to wait 4 to 6 months to get, just to get an answer. Yes, you're eligible again, or whatever. And could y'all address that just a little bit for me, please?
Speaking of the ARCIDs, I think you alluded to ARCIDs, individual ARCIDs. Really, ARCID is one of the service programs that we've been somewhat successful in getting individual enrolled in. There has been some challenges on individuals that was previously approved for like newborn coverage, and they aged out of newborn, turn 1. We have to put them in ARCIDs. It has been a challenge getting them into the immune system with their family. We try to keep the taxpayer and family together so the Medicare rules will work. So sometimes it's been a challenge with that. It takes us a little longer to get those kids into the taxpayer side of their parents. But any of those we come across, we try to get those resolved right away so the child will have coverage.
Harris Miller, I'm sorry, Matt.
No, go ahead.
And these are, they're really a handful of issues that are serious, I would say, defects in IBM correct that IBM is working on, providing staff to us to work on. And so we've got programs working, I think, literally around the clock to try and get the coding fixed to correct those issues. And as we can correct these handful of the most significant defects, you should see that situation improved. And in fact, I know there are some that have been improved already, but we still have some situations out there. Newborn coverage is certainly one. There's some others where there are some people who are having unacceptable wait times. And so we're pushing hard both on the programming side to get that code fixed so the system can handle it correctly, but also, as Williams